Fascinating stuff. I'm really enjoying this stuff. So where we lift off here? This one?
CRPS type 1 and 2, so there are two types, okay? So there are two parallel forms of this disorder with identical symptoms and treatments. CRPS type 1 is a systemic condition affecting a limb after an injury, such as sprains, fractures, infections, surgeries, repetitive motion disorder, and carpal tunnel, along with cervical spine or spinal cord disorders, venipunctures, strokes, or heart attacks. Recent research established nerve damage in CRPS type 1. Medical scientists found CRPS patients lost small fiber nerve endings in CRPS type 1 related nerve damage. Notwithstanding, the underlying cause of CRPS type 1 is unidentified.
Really? They still don't know what it causes?
No, they do not. No.
Wow.
The disease affects the sympathetic nervous system, and those suffering from the second type have confirmed nerve injury. The central nervous system is part of the autonomic nervous system. It controls a multiplicity of body functions, including breathing, digestion, heart rate, and sweating. In fact, the central nervous system activates under conditions of stress. As a consequence, it opposes the physiological effects of the parasympathetic nervous system, and it's one of the three divisions in the ANS.
Okay, let's go up to who can contract CRPS?
Anyone can develop CRPS. However, it's more prevalent in women than men.
Why do you think that is?
I'm unsure. I'm a woman. I have it. Likewise, CRPS isn't limited by imaginary boundaries. The disease is also known to affect children and teenagers. It's essential to see a doctor when experiencing continuous, relentless pain to determine the cause. Of equal importance, it's critical to treat CRPS sooner than later.
Yeah, why suffer, right?
That's right. In some cases, CRPS can be reversed if they catch it sooner than later. So within about 3 months, they say.
But you had gone way past that point. You'd had it for 20 years.
Yeah.
Okay, so what are the symptoms? This is getting fascinating.
Well, the symptoms of the disorder are equal to cruelty and continuity. According to the McGill Pain Index, CRPS rates 46 out of 50, above amputation, cancer, and childbirth.
Wow.
In general, members of society and the medical community perceive CRPS sufferers as attention seekers, criminals, and druggies. On the point of, the public holds a firm belief no person experiences this much pain. On the contrary, persistent excessive burning pain of CRPS is out of proportion to the original injury. Skin color and temperature changes accompany the intense pain, along with extreme sensitivity and swelling in the affected areas. The peripheral nerves transmit pain messages to the blood vessels. As well, nerve fibers trigger different symptoms leading to inflammation, together with blood vessels abnormalities and abnormal neurological function in the spinal cord and brain.
All right, let's move that up.
So you can see that it affects many areas. It's multisystemic, and it will affect your body wherever there's nervous tissue.
And
that's
your
everywhere.
entire body's
That's
filled
right.
with nervous tissue.
That's right. Furthermore, the affected blood vessels may open wider, triggering red, swollen skin. On the other hand, the blood vessels may become narrower, producing a cold, white-bluish limb. Muscles and tissue can become famished of oxygen and nutrients, in turn affecting muscle and joint pain. Damage can develop. Chemical messengers in the blood are partly responsible for the dilation and constriction of small blood vessels, in addition to the inner pathway of the nerve cell, the small nerve axons. Likewise, people with autoimmune disorders have reported redness, swelling, and warmth. The extra pain brings about high levels of inflammatory chemicals in the tissue, activating activated rather by neuroglia.
I even have trouble saying that. Neuroglia?
Yes,
Neuroglia?
neuroglia cells.
Neuroglia cells.
That's right. Thank
Okay,
you.
I'll move this up so you can see it a little easier. All right.
Thank you. In all burning, searing, shooting, stabbing ache and pains best define this physical suffering. It can also feel like an inexplicable impression of icy water splattered on the distressed area, creating goosebumps as well as generating torment. So when that happens, Rick, it's really hard to move. It's like your body's frozen in place and you have to wait for that to pass for you to feel like you can move a little
That's
bit.
crazy.
It absolutely is.